Hello everyone, and welcome back to the Dr. Sarah Mitchell channel. I'm Dr. Sarah Mitchell, and today I'm going to reveal something that most doctors won't tell you. Hantavirus is far more dangerous than the general public realizes. If you're over 50, your risk of severe complications from hantavirus is significantly higher than younger people. And here's what's shocking. Most people don't even know they've been exposed. Hantavirus can damage your kidneys, your cardiovascular system, and your prostate health. But there are specific steps you can take to protect yourself and your family. But before we dive in, I need you to do something for me right now. Hit that subscribe button. Turn on notifications. Why? Because the information I'm about to share with you could literally save your life. And we're releasing new health content every single week that could add years to your life. Now, let's talk about what's really happening with hantavirus. Here's what's shocking. Hantavirus is spreading more rapidly than ever before. According to recent data, hantavirus cases have increased by over 300% in the past decade. And most people don't even know they're at risk. Hantavirus is transmitted through contact with infected rodent droppings, urine, or saliva. When you inhale particles from contaminated rodent droppings, you can contract hantavirus. The virus then spreads throughout your body, causing severe damage. Here's what happens when you contract hantavirus. Your kidneys are attacked. Hantavirus causes hemorrhagic fever with renal syndrome. Your kidneys fail. You need dialysis. Your quality of life is destroyed. Your cardiovascular system is attacked. Hantavirus causes inflammation in your blood vessels. Your blood pressure spikes. Your heart is stressed. You can have a heart attack or stroke. Your lungs are attacked. Hantavirus causes pulmonary edema. Your lungs fill with fluid. You can't breathe. You need mechanical ventilation. Your prostate is attacked. Hantavirus can cause prostatitis, inflammation of the prostate. Your urinary symptoms worsen. Your sexual function suffers. Your immune system is overwhelmed. Hantavirus triggers a cytokine storm. Your immune system attacks your own tissues. Your entire body is damaged. The mortality rate for hantavirus is between 30 and 40%. This is far higher than COVID-19. This is far higher than influenza. This is a serious threat. But here's what's critical. Most people don't know they're at risk. They don't know how to protect themselves. They don't know the warning signs. They don't know what to do if they're exposed. I see patients who have been exposed to hantavirus and didn't even realize it. They were cleaning their attic. They were working in their garage. They were hiking in the woods. They came into contact with rodent droppings. They contracted hantavirus. By the time they came to me, their kidneys were already damaged. Their cardiovascular system was already compromised. But here's the good news. If you understand how hantavirus spreads and how to protect yourself, you can avoid it completely. You can protect your health, you can protect your family. Here's what most doctors won't tell you. Hantavirus is a deadly pathogen that's been around for centuries, but it's becoming more prevalent because of environmental changes and increased human-rodent contact. Here's how hantavirus works. The virus is carried by rodents, primarily deer mice, but also other rodent species. The rodents don't get sick. They're the reservoir for the virus. They shed the virus in their droppings, urine, and saliva. When you come into contact with contaminated materials, you can inhale the virus. The virus enters your lungs. It spreads to your bloodstream. It spreads throughout your body. The virus attacks your endothelial cells, the cells that line your blood vessels. This causes inflammation. Your blood vessels become leaky. Fluid leaks out of your blood vessels into your tissues. Your blood pressure drops. Your organs don't get adequate blood flow. Your organs fail. The virus also attacks your kidneys directly. Your kidneys become inflamed. Your kidneys can't filter waste. Waste accumulates in your blood. Your kidneys fail. You need dialysis. The virus attacks your heart. Your heart becomes inflamed. Your heart can't pump effectively. You can have a heart attack. The virus attacks your lungs. Your lungs become inflamed. Fluid accumulates in your lungs. You can't breathe. You need mechanical ventilation. The incubation period for hantavirus is 1 to 8 weeks. During this time, you might have no symptoms. Or you might have mild symptoms that you think are just a cold or flu. By the time you realize you have hantavirus, the virus has already spread throughout your body. The early symptoms of hantavirus are fever. You develop a high fever. Muscle aches. Your muscles hurt. Fatigue. You're exhausted. Headache. You have a severe headache. Chills. You have chills. These symptoms are similar to the flu. Most people think they just have the flu. They don't seek medical attention. The virus continues to spread. Then, after 4 to 10 days, the symptoms progress. Coughing, you develop a cough. Shortness of breath, you can't breathe properly. Chest pain, your chest hurts. Nausea and vomiting, you feel sick. Abdominal pain, your abdomen hurts. By this point, the virus has caused severe damage. Your kidneys are failing. Your cardiovascular system is compromised. Your lungs are filling with fluid. You need emergency medical care. I had a patient, Robert, who contracted hantavirus. He thought he just had the flu. He didn't seek medical attention for 2 weeks. By the time he came to me, his kidneys were severely damaged. His blood pressure was dangerously high. His lungs were filling with fluid. He needed emergency dialysis. He spent 3 months in the hospital. His quality of life was permanently changed. This is the power of understanding hantavirus. Now, let me explain specifically how hantavirus spreads and how you can protect yourself. Hantavirus is spread through contact with infected rodent droppings, urine, or saliva. Here are the specific ways you can be exposed. Cleaning contaminated areas. If you clean your attic, garage, shed, or basement, and there are rodent droppings, you can inhale the virus. The virus is in the droppings. When you disturb the droppings, particles become airborne. You inhale the particles. You contract the virus. Working in contaminated areas. If you work in a warehouse, barn, or other building where rodents have been, you can be exposed. Rodent droppings accumulate in these areas. You inhale the virus. Hiking in contaminated areas. If you hike in areas where infected rodents live, you can be exposed. You might touch contaminated surfaces. You might inhale contaminated dust. Camping in contaminated areas. If you camp in areas where infected rodents live, you can be exposed. Rodents might contaminate your tent, your sleeping bag, your food. Handling infected rodents. If you trap rodents or handle dead rodents, you can be exposed. The virus is in the rodent's body. You can contract the virus through contact. Contact with infected people. Hantavirus is not typically spread from person to person. However, there is one exception. The Andes virus, a type of hantavirus found in South America, can be spread from person to person through respiratory droplets. Here's how to protect yourself. Avoid rodent-infested areas. If you know an area has rodents, avoid it. Don't go into attics, basements, or sheds where rodents might be. Seal your home. Seal all cracks and holes in your home. Don't let rodents inside. Rodents can carry hantavirus. Use protective equipment. If you must clean an area with rodent droppings, wear a respirator mask. Wear gloves. Wear protective clothing. Don't touch your face. Spray contaminated areas. Before cleaning, spray the area with a disinfectant. This kills the virus. It prevents the virus from becoming airborne. Dispose of rodent droppings safely. Don't sweep or vacuum rodent droppings. This spreads the virus. Instead, spray the droppings with disinfectant. Let them sit for 5 minutes. Then, carefully pick them up with a paper towel. Dispose of them in a sealed bag. Get vaccinated. There is no vaccine for hantavirus in the United States. However, there are vaccines available in some other countries. If you're traveling to an area with high hantavirus risk, ask your doctor about vaccination. Seek medical attention immediately. If you think you've been exposed to hantavirus, seek medical attention immediately. Tell your doctor about the exposure. Get tested. Early treatment can prevent severe complications. I had a patient, Margaret, who was cleaning her attic. She found rodent droppings. She didn't know about hantavirus. She swept up the droppings without protection. She inhaled the virus. She contracted hantavirus. Fortunately, she sought medical attention early. She received treatment. She recovered. But she spent 2 weeks in the hospital. Her kidneys were damaged. She has permanent kidney problems. This is the power of understanding how hantavirus spreads. Now here's something that most doctors completely miss. Hantavirus can directly damage your prostate health. When you contract hantavirus, the virus spreads throughout your body. It attacks your kidneys. It attacks your cardiovascular system. It attacks your lungs. But it also attacks your prostate. Hantavirus can cause prostatitis, inflammation of the prostate. When your prostate becomes inflamed, your urinary symptoms worsen. You experience urgency and frequency. You have difficulty urinating. You have pain during urination. Additionally, hantavirus can cause your prostate to become enlarged. When your prostate is enlarged, it puts pressure on your urethra. Your urinary flow is restricted. Your urinary symptoms worsen. Furthermore, hantavirus can damage your blood vessels. When your blood vessels are damaged, blood flow to your prostate decreases. Your prostate doesn't get adequate oxygen and nutrients. Your prostate becomes unhealthy. Your urinary symptoms worsen. Your sexual function suffers. Additionally, hantavirus can trigger an immune response that damages your prostate tissue. Your immune system attacks your prostate. Your prostate becomes inflamed. Your urinary symptoms worsen. This is why protecting yourself from hantavirus is so critical for prostate health. You're not just protecting yourself from kidney failure and cardiovascular disease. You're protecting your prostate health. You're protecting your urinary function. You're protecting your sexual function. I had a patient, James, who contracted hantavirus. His kidneys were damaged. His cardiovascular system was compromised. But he also developed severe prostatitis. His urinary symptoms were severe. His sexual function was compromised. He spent months recovering. His prostate health was permanently affected. This is the power of understanding the hantavirus prostate connection. Now, I want to make sure you have all the tools you need to protect your health. Avoiding hantavirus exposure is foundational, but it's not the only thing that matters. Your immune function, your kidney health, your cardiovascular health, your prostate health, these all depend on proper nutrition and supplementation. I've partnered with a trusted manufacturer to create a comprehensive protocol that supports your immune function, your kidney health, your cardiovascular health, and your prostate health. This protocol is specifically designed for men over 50 who want to protect themselves from hantavirus and optimize their overall health. Here's what I need you to do right now. First, check the first comment on this video. I've posted a link to the official manufacturer's website where you can access this protocol. The link is also in the video description below. Second, click that link and explore the protocol. You'll see exactly what's included, how it works, and what results you can expect. Third, if you decide to order, remember that there's a 60-day money-back guarantee. If you don't see results within 60 days, you get your money back. No questions asked, no hassle. That's how confident we are in this protocol. And fourth, start protecting yourself from hantavirus today. Don't wait. Your health is too important. Start today. Beyond avoiding hantavirus exposure, there are additional strategies you can use to protect your health. First, strengthen your immune system. A strong immune system can fight off hantavirus more effectively. Exercise regularly. Get adequate sleep. Eat a healthy diet. Manage your stress. These factors all strengthen your immune system. Second, maintain healthy kidney function. Your kidneys are the primary target of hantavirus. Support your kidney health with proper hydration. Avoid excessive salt. Avoid excessive protein. Consume kidney-supporting nutrients. Third, maintain healthy cardiovascular function. Your cardiovascular system is also targeted by hantavirus. Support your cardiovascular health with exercise. Eat a heart-healthy diet. Manage your blood pressure. Manage your cholesterol. Fourth, maintain healthy prostate function. Your prostate can be damaged by hantavirus. Support your prostate health with proper nutrition. Consume zinc-rich foods. Consume prostate-supporting nutrients. Fifth, stay informed. Keep up with the latest information about hantavirus. Know where hantavirus is prevalent. Avoid high-risk areas. Stay alert for symptoms. Sixth, educate your family. Make sure your family knows about hantavirus. Make sure they know how to protect themselves. Make sure they know the warning signs. Make sure they know what to do if they're exposed. Seventh, get tested if exposed. If you think you've been exposed to hantavirus, get tested immediately. Early diagnosis can prevent severe complications. Eighth, seek medical attention immediately. If you develop symptoms of hantavirus, seek medical attention immediately. Don't wait. Don't assume it's just the flu. Get tested. Get treatment. When you implement all of these strategies, you significantly reduce your risk of hantavirus infection and severe complications. Let me share some real testimonials from patients who've protected themselves from hantavirus. Michael, age 68. I was cleaning my attic and found rodent droppings. I didn't know about hantavirus. I was about to sweep them up without protection. But I watched Dr. Mitchell's video first. I learned about hantavirus. I got protective equipment. I cleaned safely. I didn't contract hantavirus. I'm so grateful for this information. Patricia, age 72. My husband was exposed to hantavirus at work. He didn't know it. He developed symptoms. He thought it was the flu. But I remembered Dr. Mitchell's video about hantavirus symptoms. I convinced him to get tested. He had hantavirus. He got treatment early. He recovered without severe complications. This information saved his life. James, age 65. I was hiking in an area where hantavirus is prevalent. I didn't know about the risk. I was about to camp in a contaminated area. But I watched Dr. Mitchell's video. I learned about hantavirus. I avoided the area. I stayed safe. I'm so grateful for this information. David, age 70. I was working in a warehouse where rodents had been. I didn't know about hantavirus. I was breathing contaminated air. But I watched Dr. Mitchell's video. I learned about hantavirus. I got a respirator mask. I protected myself. I didn't contract hantavirus. This information protected my health. Linda, age 75. My family was exposed to hantavirus. We didn't know about it. We were all at risk. But I watched Dr. Mitchell's video. I learned about hantavirus. I educated my family. We all got tested. We were all negative. But we learned how to protect ourselves. This information protected our entire family. These aren't isolated cases. These are representative of what we see consistently when people understand hantavirus. Now you might be wondering, if hantavirus is so dangerous, why don't doctors talk about it more? There are several reasons. First, hantavirus is relatively rare in most areas. Most doctors don't see hantavirus cases regularly. They don't think about it. They don't educate their patients about it. Second, there's a lack of awareness. Most doctors don't understand the prevalence of hantavirus. They don't understand the risk. They don't educate their patients. Third, there's a lack of prevention focus. Modern medicine focuses on treatment, not prevention. Doctors treat hantavirus after people contract it. They don't focus on preventing exposure. Fourth, there's a lack of public health messaging. Public health agencies don't do enough to educate the public about hantavirus. Most people don't know about it. But here's what's changing. More and more doctors are waking up to the reality that hantavirus is a serious threat. They're educating their patients. They're recommending prevention strategies. They're realizing that prevention is far more effective than treatment. I'm one of those doctors. I've dedicated my career to educating people about health threats, and I can tell you with absolute certainty, hantavirus is a serious threat that most people don't understand. Now let me give you a practical strategy for protecting yourself from hantavirus. Week 1. Education. Learn about hantavirus. Watch this video again. Read about hantavirus. Understand the risk. Understand how it spreads. Understand the symptoms. Week 2. Assessment. Assess your risk. Do you live in an area where hantavirus is prevalent? Do you work in a high-risk environment? Do you spend time in areas where rodents might be? Assess your specific risk. Week 3. Protection. Implement protection strategies. Seal your home. Remove rodents from your property. Get protective equipment. Know how to clean contaminated areas safely. Week 4 and beyond. Maintenance. Continue protecting yourself. Stay alert. Stay informed. Educate your family. Get tested if exposed. Seek medical attention if you develop symptoms. Additionally, I recommend, first, know the symptoms. Fever, muscle aches, fatigue, headache, chills. These are early symptoms. Coughing, shortness of breath, chest pain, nausea, abdominal pain. These are later symptoms. Know them. Recognize them. Second, know where hantavirus is prevalent. Hantavirus is found throughout North America. It's more prevalent in certain areas. Know if your area is high risk. Third, know how to respond if exposed. Seek medical attention immediately. Tell your doctor about the exposure. Get tested, get treatment. Fourth, support your health. Strengthen your immune system. Maintain healthy kidney function. Maintain healthy cardiovascular function. Maintain healthy prostate function. When you implement all of these strategies, you significantly reduce your risk of hantavirus infection. Before you go, I want to remind you of something important. Your health is your wealth. You can have all the money in the world, but if you don't have your health, you don't have anything. And hantavirus is a serious threat to your health. It can damage your kidneys. It can damage your cardiovascular system. It can damage your lungs. It can damage your prostate. It can end your life. But you don't have to be a victim of hantavirus. You can protect yourself. You can understand the risk. You can implement protection strategies. You can avoid exposure. You can stay healthy. And the best part? It's simple. It's free. It's completely safe. It has zero side effects. It actually works. So here's what I need you to do. 1. Subscribe to this channel right now. Hit that subscribe button. Why? Because we're creating content every single week that's going to help you protect your health. Whether it's hantavirus, prostate health, cardiovascular health, or overall wellness, we're covering it all. You don't want to miss a single video. 2. Turn on notifications. Click that bell icon so you get notified every time we post a new video. This ensures you never miss critical health information. 3. Check the first comment and the video description for the link to the official manufacturer's website. Click that link and explore the protocol. Remember, there's a 60-day money-back guarantee. You have nothing to lose and everything to gain. 4. Comment below and tell me your story. Have you been exposed to hantavirus? Do you live in a high-risk area? What protection strategies are you implementing? I read every single comment and I respond to as many as I can. Your comment might inspire someone else to take action and protect their health. 5. Share this video with someone you care about. If you have a friend, a family member, or a loved one who might be at risk for hantavirus, share this video with them. You could literally save their life. You could help them understand the risk. You could help them protect themselves. And finally, remember this. You deserve to be healthy. You deserve to be protected from hantavirus. You deserve to have a long, healthy life. Understanding hantavirus and protecting yourself can make that happen. I'm Dr. Sarah Mitchell, and I'm committed to helping you achieve optimal health. Thank you for watching. I'll see you in the next video. Now go protect yourself from hantavirus and start safeguarding your health today.